Thank you so much, David and Niall. It's a real privilege to be in front of all of you today. It's my favorite conference of the year, getting to see so many of you in person. And I love how it says medical student of the future, because if you ask any one of my classmates, they really think of me as the medical student of the past who's come back to haunt the halls of Johns Hopkins. So one of the main reasons I returned, as many of you know, is that I think medical education has never been more exciting, more engaging, more innovative, and frankly, easier, in large part because of the amazing product and content innovations that our teams at Elsevier have created over the past several decades, and that each and every one of you are bringing to universities and health systems all around the world. So I want to pause there and just have you guys appreciate that fact and give yourself a round of applause. So, as many of you have seen on social media, on LinkedIn, I'm pretty active. I post a weekly This Week in Med School series where I talk about how I'm learning with Elsevier GME products weekly, including obviously my favorite, Osmosis. I'm a little biased, but also obviously clinical cases and complete anatomy. Like I just finished my surgery rotation, and complete anatomy was extremely useful for that. And so it's an honor for me to be able to actually come up here and show you what our team has done with the VisionPro. And I want to give them, the complete anatomy team, a huge shout out, and in particular also to Niall, Irene, and Jan, who created an amazing industry-leading partnership with Apple. So before we airplay, I wanted to make two quick notes. The first is that you're going to see me making these gestures with my hand that if you ever saw Chamber of Commerce, Harry Potter, it's a little like Snape trying to get Harry Potter off the broom. So don't worry, I'm not like casting a spell on any of you. And the second, and the VisionPro is amazing. It it tracks minute eye movements, it tracks minute gestures, but it obviously looks a bit weird if you've never been inside of it. And the second note is I just started using the VisionPro this weekend, so apologies in advance for any glitches. I think it's a bit bumpy, so hopefully if anyone's nauseous, take your Dramamine right now. But I want to tell you kind of how I would be using this in my own rotations. So say my professor tells me I'm going to be seeing a patient with a heart murmur, right, some sort of valve issue. I haven't reviewed heart murmurs. My classmates haven't reviewed it in probably a year or two. I haven't reviewed it in a decade. And so what you're going to see is how I'm going to pull up a couple different windows, starting with Osmosis, to go and learn or relearn heart murmurs and valve diseases. And so with that, let's go to the airplay at this point. All right, can you guys see my screen? Okay. Cool. Yeah, so I have a couple different windows, and you can see I can see each and every one of you, which is why I didn't trip coming on the stage. So here's my favorite website in the world, Osmosis. You can see we have the video for abnormal heart sounds pulled up, and I'm just going to play a clip real quick.
In aortic and pulmonary valve stenosis, the valve resists opening up for a moment before finally snapping open. And this causes a characteristic ejection click.
Yep.
Because the blood has to flow through a narrow opening.
Great, so I can watch this short 13-minute video on 2x, obviously, and be able to get through this video, the knowledge I had forgotten. And then I can go to clinical cases, and as we said, we have this really amazing product where you're able to pre-rehearse for the patients you're going to see. So in this case, we have a 29-year-old female named Julia who, on a regular occupational health exam, they discovered has a heart murmur. So I can go in, view the patient history, I can interact dynamically with clinical cases and ask, pre-rehearse and pretend that I'm, what are the exams I'll be doing, what are the diagnostic labs I'll be ordering, all of those kind of things. And then we're here to see, let me just close that, CompleteHeartX. So I'm pulling it up here, and I'm going to say, show me the model. So here's a little skeleton, and I can just kind of zoom through to the heart valves, which are the causes of heart murmurs, right? So a valve can be either too narrow, which is called stenosis, or maybe too weak, which is called regurgitation, and that causes different types of murmurs. And so, whoops, let me go back there. And one of the coolest things about this is I can go right up to it, right? You can see it's like right here, or far away. I think Jan's in the audience. Let me put a heart into Jan. So he has two hearts, obviously. And then one thing I got to tell Irene and the team is explode sounds a bit too aggressive for the feature. We don't want hearts to explode. But in this case, there's a really cool thing where, again, I'm working on the gestures and the spells there. So you can actually, like, this is the first and only time I've ever had the ability to go into a heart and come in, like the blood, come in through the right atrium, see the tricuspid valve. For any of you who are interested, Jan's daughter Lara is interested in being a cardiologist. You can see it's called tricuspid because there's 3 cusps, and then that's bicuspid or mitral because there's 2 cusps. And then not only that, but you can see how blood actually flows through the heart. It's dynamically moving here. Again, hopefully it's not too bumpy, or you can kind of see this okay. So that's the tricuspid valve, opening and closing normally, and you have blue blood flowing through, or deoxygenated blood to the lungs, and then it comes back, goes through the bicuspid valve, and that's oxygenated blood. So super cool, very, very cool. I'm going to close that. And the last thing, I don't want to steal anyone's thunder, but I'm going to have Laura and PJ come up and say how we'd be using clinical key AI in practice, because all the things I showed you right then are for a medical student, nursing student, anyone to acquire knowledge, rehearse that knowledge, and then go in front of a patient where clinical key AI comes into play. So thank you so much. Welcome to the stage.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more